Hi, everyone. Welcome. Thank you so much for joining us and being here on the podcast with Becoming the CEO of Your Health. It's Kelly Lupsha with the Lupshas, but today I have a very special guest to bring you. You know, my ultimate goal, and Arthur, my ultimate goal is that we want to help you sift and sort through what's out there in the world today. There is so much in the health and wellness field. And if I can bring you an expert that you or a family member or a friend can benefit from, then I hope to be doing my job. So today, our guest is Dr. Lorraine Maita, and I'm going to read you her bio because honestly, you guys, it is so impressive. And I think through all of our lives, it's important to know what we've done and give us all, credit for where credit is due, because not all of us are the same. And we each bring something very unique to this field of health and wellness and medicine. So I really don't want to miss a thing. So I'm going to specifically read it to you guys. She is a recognized and award-winning holistic, functional, and integrative and anti-aging physician, as well as author. She has transformed people's lives by getting to root cause illness and using the best of science and nature. Oh my gosh, absolutely love that. Her approach is personalized, where you are treated as a unique individual that you are. Dr. Maita serves as the Chief Medical Officer and Medical Director for 3 Fortune 100 companies and was on the advisory team member for WOR Radio, Change Your Attitude, Change Your Life, on the #1 news and talk radio station in New York Metropolitan area. Holy smokes, you guys. And nevertheless, she's also the founder of the Vibrance for Life Wellness Institute and has her own private practice in New Jersey. And at the end, you guys, I will leave in the show notes of how to find her, where her websites are, how you can reach out to her, because I have a feeling you're going to want to take a listen to not only what she's saying today and sharing today, but maybe how she can help you guys in the future. So, oh my gosh, Dr. Maita, welcome, welcome. How are you today?
Oh, I'm fantastic. I love your energy. This is why I love that you're bringing this knowledge and sorting and sifting, because it's too overwhelming and Dr. Google doesn't know you. That's it. They don't know you. Dr. Google is just standard, and everybody is not standard. That's the whole premise behind functional and integrative medicine.
Isn't that the truth? Because there are books to read, there are places to go, and unfortunately, like you said, with anybody and everybody being able to publish onto Google and put things out there, it is really hard for people to understand, is this for me? Will it work for me? Is this real science, or is this something I should look into more? So I just appreciate you and your willingness of always, educating people and putting so much out there for the world, because people do need to be educated. And today, you guys, we're going to kind of dive. I'm going to have Dr. Maita share a little bit about, her background and some of her areas of specialty she has, even though she treats a litany of different patients with different diagnoses and different symptoms going on. She has some real specialties that also ring true to my heart. So maybe you can give the audience a little bit more about your history and kind of, why do people even come to see you? What's so special?
Well, I think part of it is my broad background, and like anybody else who goes in this type of medicine, you do it out of necessity. I worked in a midtown Manhattan, right in the heart of New York City, emergency room. And I used to see people come in and, you'd work hard to get them better and you'd give them all the right things. And then they'd be back again and again. It was like a revolving door. And I worked there during the AIDS and TB epidemic. And unfortunately, I came down with TB.
Wow. Okay.
So I had to be on antibiotics for 9 months, and I was a giant yeast ball. That was before I knew a lot about functional medicine, and that's when I got deeper into it, because I started gaining weight and getting food allergies and rashes, and I was tired, and I just never quite felt right. And that's when I learned about the elimination and detoxification diet. I did that, and within 3 months, perfect, back to myself again. So I said, there is something to this, so that when I got tired of, just patching people up, and I set the intention, I want to write, I want to teach, I want to speak, I want to make a difference in people's lives so they're not back here in the emergency room all the time. And I ended up getting a job at Prudential, and I started as a staff physician, and I put together all their policies, their procedures, their protocols, and we instituted wellness there. I'm a lot older, so that's why I'm into anti-aging. But we were one of the first to introduce yoga, meditation, massage. We had this stress room where people would listen to peaceful music and guided meditation. So that was, very foreign to any corporation, and it was not that well established and accepted.
Yeah, you were really shaking things up then, right?
I did. And, we won awards for our wellness programs because I presented in Washington, D.C., and we were the first with, I had to deal with a lot of pandemics and epidemics, AIDS, SARS, avian flu, bioterrorism, business continuity, disaster planning, and, all of that happened. These were huge companies I worked for, Pfizer, Prudential, and Johnson & Johnson, and it's the microcosm of the macrocosm. Anything that happens in the world happens there. You have so many people that you had to find a way to help people, and I always wanted to do it through prevention. And it was interesting because I started going through perimenopause, and I'm here. I am treating other people because I was really, when I started Prudential, I was fairly young, and these executive women would come down to me and say, "Oh my God, you got to do something. I'm standing in front of people and I'm dripping in sweat and turning red. It's embarrassing." And that's when very few women were executives.
Mm-hmm.
So I learned a lot about bioidentical hormones. And for a while, people would come to me and say, "I want what she has." They would talk, and I developed a reputation for that. And then when I went to Pfizer, they made Viagra. So a lot of men would come in, "Hey, what about that Viagra?" They would never come out and say what's going on. And
yes, of course.
would open the conversation. And then, I got involved in testosterone replacement therapy. And then I went through my changes. So I became the big hormone guru.
Oh my gosh. You know what? I want you to talk more about that, because I think it's an interesting story that you had being on those antibiotics for 9 months, how it changed your body. And what I'm realizing is so many people out there in the world, maybe more women than men, but in general, as they're aging or they've gone through something medical and they don't feel like themselves again, they kind of then accept that as the new normal. That I'll just have this extra 15 pounds of weight, that I'll just have this decrease of energy, that I'll just have because of what they've gone through. And so I love the fact that we now know that so much of that has altered the system inside, right? Whether it's at the genetic level, the, hormonal level, your microbiome, I mean, you name it. And actually lots of it can be reversed with what we have today. But most people just think maybe this will just be my life. And you were like, "I'm a warrior. I want to feel better again."
Absolutely. And it changes people's lives. In fact, today I had a patient, I did a telephone call with her, and she is saying, "You were so right. I got my life back. I didn't know I could feel this good again." She says, "Would you see my husband?" She got her libido back, and now she said, I think he needs testosterone. She said, "I feel so good. And whatever you did, I now understand my body and how I react to things, because I have to teach people how to tweak it." When you go to, say, a primary care or an endocrinologist or a gynecologist, if they're even willing to treat with hormones, everybody gets a standard dose, and not everybody reacts well to that. And I actually tailor it. I say it's like couture clothing. You nip and you tuck and you fit it exactly to the person, and then it's, wow, what a difference. And people are afraid, so I make sure I educate people before they even make that decision. Because people are worried, does it cause cancer?
Yes.
And the studies are stacked towards the old synthetic forms of hormones that were high dose synthetic given to women 10 years past menopause, and they caused clots, they caused, they found it's progestin, the synthetic progesterone that's the cancer causing, not natural progesterone. And they even did studies that estrogen alone did not increase the risk of cancer. So There are fewer studies on bioidentical hormones, but the ones that have come out of Europe, because they study that more there, it's been in wider use there. They said it was about comparable to women not on hormones.
Wow. And, I think we still, when people start talking about that, we revert back to old school. Because I even remember as a young kid, my mom had a total hysterectomy early in her life, and she started having to go on hormones. But again, back then, they were all synthetic. And so,
Yeah.
oh my gosh, her poor body was just crazy. So that's like my first thought when, as I'm starting to become an aging woman, that I kind of have thought about. But even for me, as I've had my medical journey and I talk with my naturopath, that, oh gosh, it's so different today. But exactly what you said, she's like, Kelly, there is no standard dose. And I have to look at a detailed, extensive lab to know what you're going to need versus what someone else is going to need. And honestly, like you said, it's this constant tweaking because, again, even though I think you might need this, how your body ultimately responds might be slightly different.
Right, and people don't realize it, even after menopause, you still make estrogen, but there are 3 kinds of estrogen. The one you make in menopause is inflammatory. And that estrogen can be broken down. All 3 estrogens are broken down by your liver. The way you break it down makes a difference. That's why I do a special urine test to look at how you break it down. When they did studies on women without a history of breast cancer or without a family history of breast cancer, they made a benign form of the breakdown product, 2-hydroxyestrogen, whereas women who had a history of breast cancer or a family history of breast cancer made 4-hydroxyestrogen, and that damages DNA, which can lead to cancer. So I look at the hormones, I say 3D. I look at it in blood, saliva, and urine because there are 3 different compartments. Where it is, blood is like your bank account. It can go into your tissues or you can pee it and poop it out. The urine tells me how your liver is processing it and whether or not you can get rid of it. Because if you don't, it gets reabsorbed, and it gets reabsorbed in a toxic form. You don't want that.
No,
and then I look at saliva because that reflects the tissue levels. So there's a lot more to it to minimize any kind of risk and make you feel better.
Yes, yes. That, I come from a family history. So my maternal grandmother had breast cancer. So I've always been a little bit like heightened and thought like I need to take care of my health because what if, right? Because the risk of women is so high. And it's interesting that what I'm doing today and how I've lived my life is affecting all of those genes for me. And I think for a lot of women out there, it's important that you seek somebody that's looking at all of these components for you.
Absolutely.
So maybe, my next question is, you have a woman who maybe starting in their, mid to late 40s feeling, I don't know, they just don't feel the same anymore. What would you suggest? How does somebody even start? Like, what type of doctor should they look for? And kind of what should they expect is coming in the next future years, I guess?
In anywhere from the 30s to 40s or 50s, women go through perimenopause. That can last 10 years. Mine lasted 12. But you still make estrogen because you make it in your fat and your adrenal glands and your ovaries. It's easier to make estrogen. It's just that we run out of eggs and we can't make progesterone. So it's what they call estrogen dominance because you're making estrogen, the hormone of energy and growth, and the progesterone to balance it from ovulation from eggs that we ran out of plummets. So you get anxiety, irritability, impatience, insomnia, growth of the breast, cysts of the breast, tender breast, weight gain, fluid retention, bleeding, spotting, fibroids. So if that goes on for 10 years, you can get all of that. And women just
that doesn't sound very pretty. Yeah.
No, but basically it's easy to fix. You lower the estrogen by getting rid of environmental chemicals that act like estrogen, especially BPAs in plastic and herbicides and pesticides, making sure you get enough fiber. You lower the estrogen that way and get rid of it. And that's why I do the urine test to metabolize. And sometimes you just give it some progesterone because your estrogen is here, your progesterone's down here, you bring it up, you're in balance, and life is beautiful. Life is beautiful, People can't believe it because they sleep, their weight comes off, they don't have those painful cysts anymore, and their moods are stable, because that's what most husbands call me for their wives. They find me for their wives because they're like, I can't live with her anymore. She's suffering, and I want to help her. Would you see her?
Wow, isn't that sweet? Like
It's
knowing
very
that my
sweet.
wife is suffering, right? Like
Yeah,
this isn't her. Something's different. I really want to help
right,
her. Gosh,
right.
and then so in this journey, then would somebody need to be followed regularly? Because when would they know as they're continuing to age if they need to have changes and shifts in what they're taking?
Well, it's based on the symptoms, and that's why I follow people regularly, because you can be in perimenopause. I saw somebody and I said, I don't know how long you're going to be in perimenopause. Some people, I had one woman 3 weeks later, she went into menopause. I warned them on what to look for. And I had people 5 years, 10 years later, they're still in perimenopause. So it's unpredictable, but when you cross over from perimenopause into menopause, you get the hot flashes and night sweats. I say the Suzanne Summers 7 dwarfs of menopause. Bitchy because you're dry, bitchy because you're irritable, sleepy because you can't sleep, bloaty, sweaty, hot flashes, night sweats, insomnia, and foggy, forgetful. So those are symptoms when you crossed over. And the interesting thing is PMS is the other end of perimenopause. PMS and perimenopause. PMS, your hormones are ramping up. Perimenopause, they're ramping down. You're going to get a lot of the same symptoms. And
Okay.
I do PMS a little differently because I want to help women make their own progesterone, but by the time you're in perimenopause, you've run out of eggs. It's really, a lot of those things aren't going to work anymore. So at every stage, there's something to do, and also diet and detoxification is extremely important.
Yeah, I mean, I think everyone's starting to understand. If you don't already, you definitely need to dive into diet. And I think the word diet, I wish we could almost have a different
Yeah,
name for it.
yeah.
Because everyone still thinks diet, like, oh, do you mean diet? Like they go back in the old days, like, oh, I'm thinking of like Atkins or Zone or this or no, today it's right, like keto or paleo. And we're talking just what you put in your body, right?
Right,
Diet,
it's a
just your
lifestyle.
choices, the lifestyle.
And even that, we tailor the diet. We tailor what you eat to what your condition is. I have to sometimes twist arms to get people to do detoxification with my nutrition coach. You eliminate things for just 2 weeks, not forever. And we heal the gut, we calm the immune system down, we detoxify the liver so you can process your hormones better, right? The liver is like so overloaded these days. We're exposed to 2,000 chemicals a day, and we probably have about 200 in our bloodstream at any one time. So people feel magnificent after that, and then they can process their hormones better because their liver's been unburdened. And I've had people where they didn't even need hormones after that, where I had people who had severe arthritis and autoimmune disorders that they could barely walk when they came in here, and they were on Enbrel or Humira, costing them about $4,000 a month. And we detox them, and it's, wow.
Wow. That's
They're
pretty
off.
impressive.
They're off that. And somebody said, do you know anybody that needs this? I have $4,000 worth of this medication that I don't need. I said,
Wow. I
oh, I
mean,
take people off.
you know what? After, historically in our practice
Uh-oh,
in
you just
stroke and
froze.
I think you'll hopefully come back to me here. Historically in our practice, we have seen with stroke and brain injury, people come to us with more and more and more medicine.
Uh-oh, technical difficulties. I can't hear you.
You can't hear me.
Oh,
So
now
hopefully
I
we're
can.
back.
Okay,
Are we back?
we're back.
Fantastic. I was just saying, historically in our practice with stroke and brain injury, by the time people come to us, they've added so many new medications have been added that these poor people can like hardly even function and do what we're trying to get out of them. And really traditional doctors then are so resistant to getting people off their medications.
Yeah.
So maybe just share with everybody, when you say detox, I think people don't understand what that is. They think about drug and alcohol detox, or they think about getting rid of everything in their life detox. They don't really understand what that means. So maybe
Having clean filtered water.
Okay.
So, the liver takes things out, we put things in. Our environment is polluted. So it's eating organic, having clean filtered water, having, when you can, you don't have to be as pure, but looking at the chemicals in your environment and your personal care products. But I use some herbals to help people. So we clean whole foods without all these preservatives and artificial ingredients, artificial fragrances or flavors or sweeteners, because all of these are toxins. They disrupt your immune system, your hormone system, and your nervous system. So what a detox is eating clean and pure, as pure, as Mother Nature made it, and not having processed foods, giving your liver a break by taking some herbs that help you get rid of stuff, and healing the gut, removing the common foods that cause sensitivities and inflammation, because inflammation is the root cause of illness. And then you figure you add them back. We don't want people not having things, but then you figure out what's disturbing you, what's causing these symptoms, because people they come in, they're tired, they're moody, they have mental fog, they're gaining weight. Those are like my top things. I say people come to me because they're feeling fat, flabby, flaky, foggy, fatigued, and forgetful. And everybody laughs because they raise their hand, that's me. And sometimes just after the detox, they feel magnificent. And then you add the hormones, and that's, if they need it.
Yeah, of course.
It's the icing on the cake. It's, oh my God, I got my life back.
Wow. Well, maybe before we wrap up, we've talked a lot about women. So maybe just give like one piece of advice, or your number one question you get asked about men.
Oh, usually, is it my testosterone, and how do I raise testosterone? And one way is to get your stress down, because if cortisol is up, it pushes testosterone down. I get people better just from managing their stress.
And I think there's probably not many people out there in the world that couldn't benefit from lowering their stress, right? I mean, but most people think it's a little, like I should be racing and running and like, oh, taking care of myself, calming, reading a book, meditating for 5 minutes. They kind of think that's woo-woo. It's like, no, that's actually one of the most important things to get your body back.
And sometimes I offer them heart map, because that's science. There are 2,000 studies on that, because some of them don't want the meditation, or that's not them, that's too woo-woo. But heart map is scientifically proven, and it's quick and it's easy, and it's been used by elite athletes and CEOs. So it's a wonderful technique. So if you get the cortisol down, you cut back on alcohol, you do weight and resistance training, you get your vitamin D up, and you take some zinc, oftentimes that corrects it, because men turn their testosterone into estrogen often. And men on testosterone, if the doctor doesn't measure downstream hormones, and I hate to say it, but a lot of doctors don't. They just give everybody the standard and that's it. And they look at the testosterone levels, but they're not looking, is it turning to estrogen or dihydrotestosterone? And that could be problematic if they get too high.
Right. Gosh. So everyone I think thinks about, hormones, and they think female.
No.
So thank you for sharing that, because it really is important. I've really been like telling my husband, he doesn't really have any ailments going on. But you know what? I really took a deep dive over this past year or two in my health to making sure I'm really is there something more I can do to optimize where I'm at today? And I'm encouraging him the same. And I guess I would tell all of you out there in the audience listening that, you may not think anything is going on in your body today, but probably each and every one of us are always in this tipping point of balancing what's really happening inside. And don't wait till you feel something go wrong, right? I mean, is that what your recommendation would be?
Little tweaks. I have people who come for a yearly physical because I'm going to look at more things than others. They say, I feel good. I want to continue to feel good. I want you to take a look to see where I'm at.
Oh my gosh, I love that. I feel good. I want to continue to feel good. You guys talk about prevention. That's what I hope each and every one of you, if you're not feeling good, definitely seek help. If you are feeling good, let's keep up with that and don't let yourself your health fall off the radar.
Yeah,
Oh
you
my
don't
gosh.
have to feel bad. I can't believe some of the people that transformed, and they can't believe it either. So if that could happen to them, it can happen for you.
I love
So just
that.
be open and willing to try something different.
Oh my gosh. Okay, so can you leave the audience, Dr. Maita, with, if you could tell them one thing, right? Like you've shared so much with your wisdom today, but one thing kind of in summary to leave the audience, if people got distracted and they weren't paying attention, like, all right, everybody, pay attention and leave them with one tip. And then also where can people find you?
Sure. Food is food first. It's always food first, because that's the one that you're putting in your body all the time. Eat clean. Do what Michael Pollan said, mostly plants. I'm not a vegetarian, but you're going to have some meat, but don't make the meat the biggest part of your plate. Make the veggies the bigger part of your plate. Eat what came from the ground, not in a box or a bag. And my website is howtoliveyounger.com. And I'd love to offer your listeners a download that explains a lot of this. It's called, if you go to howtoliveyounger.com/magnificent, it helps people understand how you can go from miserable to magnificent.
Oh
It's
my
my
gosh.
best tips.
Miserable to magnificent. Like, who doesn't want to go to magnificent?
Yeah.
Sign me up.
So a lot of what I talked about is in that download, and it's free, and it's very, very practical, helpful advice, nothing that exotic, and you can do it.
Oh my gosh.
You can feel magnificent.
You can feel magnificent. So you guys, it's howtoliveyounger.com /magnificent.
/magnificent.
Backslash magnificent. Perfect. And I'll put it down below in the show notes. I would highly encourage you guys to go get that download, have it for yourself, because sometimes hearing things once, you I kind of got it, being able to hear it and then read it or see it a second time may really help you start to implement some changes in your life. So thank you so much for your time, your education, your willingness to give, to serve and help others out there in the world. It's such a pleasure to have you, Dr. Maita.
Thank you so much. I so appreciate getting the word out, because I can't stand anybody feeling miserable.
All right, you guys, let's go from miserable to magnificent. So thanks again for joining our podcast on becoming the CEO of your health. And please feel free to give us a 5-star rating. We would absolutely love it. And share this podcast out there with somebody that you love that you might think could benefit as well. So thanks, everybody. Have a fantastic day.